Hi, I'm Nick from Quit with Nick, helping you become a happier, healthier, wealthier non-smoker. Now, in the first video, step 1, I shared the number 1 step to getting started on the journey of becoming a permanent non-smoker, and that's commitment, right? So now you're committed. You've made the decision. That's it. I'm doing this. Enough's enough. The time has come. I'm over it. I'm committed. Step number 2 will be, how am I going to do this? What method, technique, avenue am I going to take for this journey of becoming a non-smoker? Now, obviously, there's a few things that you could do. And here's the important thing to keep in mind. Every single way of quitting cigarettes has worked for thousands of people. Any of them could potentially work for you, because every method you can think of has worked for many, many people, starting from cold turkey. Cold turkey is not an aid. It's nothing. You're not using anything other than your own commitment, mindset, willpower, all of that. People have quit cold turkey. Many people have, So logically speaking, any method, technique, or anything designed to help you quit really, should be of assistance if cold turkey can work for people. But doing some research on a particular method is important. Now, I believe that the best mindset to approach a method is by asking yourself, what method am I going to make work for me? Sometimes smokers will do it the other way around. They're going to go, what's going to work for me? What out there is going to do the trick for me? There's a slight difference in that. In a way, it's kind of avoiding responsibility and sort of putting all the onus onto the method. Now, obviously, the method needs to help it make the process easier for you, of course, easier than cold turkey. At the end of the day, any method you're going to use, you're going to measure it against cold turkey, aren't you? I mean, there's nothing, and then what I'm going to use from there, and everything you're going to try, you're going to compare to how much better am I feeling because I've done this as opposed to cold turkey. Whether you use a patch of gum, a pill, a spray, a lozenge, Allen Carr, acupuncture, hypnotherapy, right? But the approach that's going to help the method work for you is by asking yourself, what am I going to make work for me? And that comes back to step number 1 and video 1, commitment. If you're really committed to quitting, you're going to have that mindset of, I'm going to make something work. This is going to work for me because I'm going to make it work. If you've got that mindset, I can almost bet that anything you try from there is going to help. It's going to help for sure. But do some research. Look, and by the word research, you get to choose how you do that. Are you going to ask some people how they've quit? How did you quit? How did you quit? What did you find worked? What did you help? Of course, that might help you make a decision on choosing a method, but keep in mind what may have been a silver bullet and amazing for one person may not be for you. Don't throw the baby out with the bathwater. If someone says, I tried patches, I tried Allen Carr, I tried hypnotherapy, it worked for them, but you got to resonate with that technique. You got to have a level of belief that you can make it work for you. If you're totally like, no, I'm not going to use drugs. I don't believe in adding more nicotine into my system. I don't believe in, the drug companies and all those chemicals. Well, then, if that's the way you are, chances are that's not the right method for you, But do a little research on different methods and look at reviews and look at what people have said and look at what chemicals are in that. If you're using nicotine replacement therapy, well, yeah, look, there are going to be some chemicals. There could be side effects. If you're considering Champix or your doctor is mentioning Champix, or most doctors don't prescribe Zyban anymore, but Champix, do research on Champix. It's an antidepressant. That's how they discovered it. They're trialing an antidepressant drug. Many of the patients were smokers. Some of them were quitting. Oh, well, let's use the drug as a quit smoking drug since some people are quitting. Hence the really crazy dreams and side effects and going crazy and feeling nauseous because these are some common side effects of antidepressants, so do your research. If you're going to do hypnotherapy, it's important to look at their process, their qualifications, their success rate, how they determine their success rate, any pre or post session process. Just get informed. It's your time, it's your money. You want to have something work, you want to make something work. So it's the obvious next step. Do your research, see what's out there. So that's step number 2. Now, in the next video, I'm going to share hypnotherapy and if it might be right for you, and it may not be. So some of the things that you might want to consider if hypnotherapy is on your mind. Step number 3 in the next video. See you there, Nick from Quit with Nick. Take care.